So I shocked a lot of people in my last video and I didn't realize it. I said you should never Botox your forehead, and so many people do. And what if I told you you can look 10 years younger very easily without Botox in your forehead with things that you can do at home? And the reason is your forehead takes up 35 to 40% of your face. How can you ignore it? And guess what you're gonna say? Rajani, I wear my hair down. And I do too. When I'm on the water getting sun, it's the best coverage of my forehead is my hair. But here's the thing. Even if you cover your forehead, guess what your forehead does? It does something to your eyes that you're not even thinking of, and I'm going to show you exactly that today. Unfortunately, that eye change, it's aging you by 10 years. We want the opposite, 10 years younger. I'm also talking a little bit about Botox resistance for those of you that think your Botox is not lasting longer or you become resistant. I'll give you advice on that at the end of this video, but keep in mind, most importantly are the things in this video that you can do at home to prevent and maintain what makes up 40% of your face. Let's get started. So first of all, why is this so important? Well, let's look at the eyes with relation to the forehead. And there's a huge connection that I want to make you aware of. If we look here, the forehead, of course, we're seeing makes up a good percentage of the face. And that's why we got to pay attention to it. For one, it's smooth, but it's also about angles. And what do females have? A nice, wide open eye, okay? For you symmetry people, I want to show you one thing here. Do you see how this eye is sitting lower? In my guess, if you look at all of Dua's pictures, probably this will be her lower eye. No big deal. This is normal. It makes us who we are. Don't perseverate over those things. But it's something I first noticed. And of course, we're all different, so you can overcome these things. But just as an injector, that's what I'm looking at. How am I going to raise this side and not lower this side? And these angles that I'm telling you about, if your injector doesn't think of this, or you don't think that they know these angles, you turn around and you walk out, because that's not who you want to be seeing.
Fired. I beg your pardon? Fired. But I... Fired!
I'll tell you what, at the end of this, just to be interesting, exactly the pattern I would do for her. For one, I'd probably do nothing. I wouldn't treat her. As we get to the end of this video, you'll know why. But we want to keep that nice wide open eye. That says female. I'll contrast that with a male in a minute. But the male will have a narrower eye. Look at the forehead. There's no frontal ridge like a male would have here. But the key to this is the muscle that we treat when we talk the forehead. This is what I'm talking about. That it's called the frontalis muscle. I'll show you in a moment. But it's not the glabella. This is the glabellar complex here, okay? That's not what we're talking about. This actually, if you treat this, that will raise both of her eyes. This is the forehead that I'm talking about. And having a smooth forehead is, of course, very feminine. I know it's very desired, and I used to use 20 units 20 years ago back in that area. Today I'll share with you exactly the dose and the kind of pattern that we would use. I wanted to show you one more face to make this point. Okay, what do you see here? Again, you're going to see one brow that's a little lower. Totally fine, very normal. But a nice wide open eye. Here's one thing I want you to pay attention to. If I can demonstrate this here, you might have to come up closer to the screen, but do you see this distance? A male does not have this long distance, okay, on both sides. A male has a shorter distance. I'll show you in a minute. But that's the distance we need to maintain. If we lose that distance, we're going to make her look older, my writing's terrible, isn't it? Unhealthier, tired. And here's the biggest thing we're going to make her is what? We're going to make her angry. Because the forehead is something, if you lower the forehead of a female and you lower the eyes, you change that distance, and you lower that, you minimize the distance, that's an angry female. And that's going to last, in general, 6 weeks.
And it can't happen again. So fix it!
Many of you have had this. You can comment below. By the way, I do this in real life. I treat real patients. And so I also answer all my comments below. So feel free if you have questions on what I'm talking about to ask below. And if you think the Botox box injectors that you might be going to are going to be upset with this video, well, you're correct, but we don't mind that here on this channel. It's all about you, saving you money, but most importantly, getting you the best look that you can. Let's keep charging. Something else we can learn from this picture is she's what? Smiling. When you smile, the eyes close a little bit. So she has a nice wide open eye despite smiling. If you did the wrong pattern and you lowered here, she smiled, those would be even less dramatic. She'd lose that beautiful feminine wide open eyed look. Now look what she's doing. You see those forehead lines? She's activating her frontalis. We need to take a look at that. So this is the muscle in question. That's your forehead muscle we're talking about. It's called the frontalis. See if I can spell again. The frontalis, okay? So if you want to look that up. It's not the glabellar complex here, okay? But this muscle here, the one that you're getting Botox if you're getting your forehead, the only thing that can do is what? Lift. So what Botox does, you know the word paralyze, we don't like to use that, but it stops muscle movement or paralyzes. If you paralyze the lift, what do you get? You get a droop. Now remember, this is the glabellar complex. That's not what we're talking about. If you treat that, that's a depressor. So if you treat the depressor, you stop the depression, you get a lift. Important to know here, if we go back to Dua's pattern, you know, if you treat the glabella, boom, boom, boom. And then there's a muscle here that you can treat, part of this orbicularis oculi muscle. If you treat a portion there, and you have to be very, very careful with depths or you are going to get a lid droop. And you treat the lateral brow, you do a little more on her droopier side, she's gonna love you. Do you love me? If you had your eyes lowered, I feel your pain. I remember 2011, I did Dysport in my forehead when it was first FDA approved. I lowered my eyes. I woke up 5 days later and my eyelid was resting on my eye. And I said, oh, just getting a little bit older. I didn't even put it together. I'd forgotten that I'd even had injections in my forehead, just cruising along in life. And then I was like, oh, that's what it's from. And I had 50 units in the forehead. Now, I don't even treat my forehead, but maybe every 18 months. So I always have full movement, but I don't feel like I have lines in my forehead that I have to treat. That's the goal for my male and my female patients, but males do need more. The nice part is we get away with the male, not the female. Just so we're inclusive of the males on this channel, look at this forehead skull. You can see the different slope of the angle of the female, but look here, there's a ridge on a male. And what you can do is be more aggressive, because if you lower the male, often it's okay. But that's what creates a male forehead and why the pattern is so different for males. And look here, there's something called the nasofrontal angle. That's different in a male as well. So all these things are calculated by your injector. This forehead is well demonstrated here on Dua. You see the gentle slope. There's no frontal bossing or projection here. And look at that sloping nasofrontal angle. We never want to forget the profile. It's oh so important, whether it's the lips, the chin, the nasal projection, but the forehead, yes, the angle is important. Okay, so what should you do? What's your course of action here? Number one, prevention. We talked about sun blockers already with hair. Keep in mind, hats, of course, sunscreen. You want to get a great sunscreen that doesn't leave a white cast that you're going to use. Absolutely key. And if you have to wear clothing, I know that's sun blocking clothing. One of you commented the other day, I know it's silly, but I wear this thing over my face. I'm all for it because photo damage makes me a lot of money. If you can avoid getting sun damage, you're going to keep your collagen and elastin. So prevention. So skincare, it's going to be your best friend on your forehead. A novel one you want to consider something called Reeboks Line Relaxer. It's not Botox, but it has peptides within it that act like Botox. So it will work over that whole muscle, but minimally. It takes the edge off the movement. And when you do that, you don't get the droop from it, but you get the benefits of the relaxation. Now, if you combine this product with an alpha hydroxy acid cream and layer it, the AHA cream is going to attack brown spots. It's going to help build collagen, thicken the dermis, give glow to your forehead, but also many, like mine, have a beta hydroxy acid in it. That's going to hunt down the pores. And what do you get in the forehead and the glabella? Sometimes it's the T-zone for people. Remember, we want smooth skin so you get good light reflection and you can show off that forehead. There's no need to hide 40% of your face. Now, a retinol, I prefer retinaldehyde, can be added to it. The last one I think you need to really consider is a hyaluronic acid cream with argireline in it. Argireline is another peptide that can act like Botox. You see what we're doing here? We're slowing the muscle movement down, not abruptly with something like Botox, Dysport, Xeomin, Jeuveau, or the hundreds of toxins that are around the world, but with skincare. Next, you want to consider chemical peels. A combination chemical peel a couple times a year works wonderfully up here. It won't affect movement. It helps build collagen. It tightens the skin. What does it do? Gives you glow. A cautionary note here, I want you to be very careful with RF, radio frequency. RF microneedling, I have many videos on. I never use it in the forehead. Forehead fat is precious. Watch my videos on how to keep your facial fat, and also keep in mind there's not a lot of fat in the forehead. So RF microneedling for me is a no-no. I do like fractionated RF. That's radio frequency that doesn't have needles. Be mindful. See an expert before you let anyone touch your forehead with energy. Much better, much safer are smooth PDO threads. Of course, I have many videos on those. But smooth threads go in. They actually lift your forehead. There's a couple of benefits here. One is they build collagen. You can't get an occlusion like you can with filler, necrosis, or blindness. So much safer, much more accessible with threads. You need to see an expert. You need to have real threads, and you can need a couple of sessions. Now, once you've had threads, then you can go for the lifting barb threads or the cat eye. And many people say this is extreme, it doesn't work, you get scar tissue. The reality is, yes, the first time it might last 2 to 4 months. It's very easy to do, to put these barbs in. You do need an expert, okay? But generally, it's not the most technical thing in the world. Again, you need good threads, you need a good provider. But what happens is, after you do a session of them, okay, you get used to them, and then you do maybe another session, and then at a year, another session, you'll find the forehead stays lifted. And you don't have to toxin it, you don't have to droop it. And if you're taking care of your skin with the sunscreen, with the skincare, it can last you a few years. And it also saves you from a forehead surgery or a brow lifting surgery, which can, what happens when you get a brow lifting surgery? Of course, your hairline goes back. And the male and female hairline, as you know, is different, but you don't want to change your hairline as a male or a female, but understand that can add a masculine look to somebody, because of course men normally have a receding hairline. It's part of our dihydrotestosterone conversion and many other factors. So I'm trying to avoid you from having to have anything dramatic done or surgeries or things that are going to take away from a feminine, wide-eyed, open look. If you're having trouble finding a great injector, remember I have a store locator, store.RajaniMD.com/locate. These are retail outlets that carry our product, but often they're in our training circles as well. It's a great starting point for you. Now, you're absolutely going to want to watch this video up here on baby Botox to save you money and get the exact right pattern for you, and one down here on Botox resistance in case you're thinking you're wasting your money, it's not working, what you can do about that. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.